You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Westchester County's go-to implant dentist. We have Dr. George Sepiashvili. Dr. Sepiashvili, welcome to the program.
Thank you for having me, Randy. Good to be back.
Now, your patients call you Dr. George.
They do.
Is that right? Much easier to
Much
do?
easier, yeah, and friendlier.
And I said Westchester, but you draw from a big area, right? People travel to see you.
We have people coming from all over. We have patients traveling from other counties in New York. We have people traveling as far as Florida and California.
Okay, good. And now for people that don't know your practice, I guess you also work with your wife.
Yes.
She's been on the show as well. But for people that don't know your practice, who's the typical dental implant patient that you see?
I would break them up in two categories, Randy. One are denture wearers. They've had dentures made for them. They are unhappy with the way they smile, with the way they are unable to eat and chew. They're just not comfortable. They're looking for better options.
Okay.
Some of them have been told they have no other options. That would be one category.
Now, by the way, for those people, you've told me, on the day of the procedure, like a denture wearer can walk in with no teeth and walk out with upper and lower teeth. That in some cases don't come out.
That's exactly right.
Is that rare? Or
No, that's every day in our office.
Okay.
You walk in, no teeth. You walk in with ill-fitting teeth or teeth you're not happy with, that you've been dreading wearing for this whole time, years, sometimes decades. You walk out with teeth you can be proud of and teeth that are staying in. They're bolted in your mouth. They don't come out.
Very nice. Now, the second category of patients are what?
Second category of patients are patients with failing teeth, with terminally ill teeth. Those are your typical bleeding gums, hurting teeth, bone loss. This process for a lot of these patients, it's a long and painful process. You lose one tooth here, another tooth there, and one day you wake up, you have no teeth to chew on, you have no teeth to smile with. Well, this process is completely opposite to that.
Okay.
Doesn't take you years to get your smile back, to get your life back. You walk in with failing teeth, you walk out with teeth that are smiling and chewing, that are healthy, that are pain-free, that you can go and enjoy the rest of your life with.
Now, I had you on the program, more than I think 3 or 4 years ago.
Yeah.
What's changed since then? How's it different?
In a lot of ways, it's different. I think the thing that changed the most is my appreciation of how much these procedures change the life of the patient. What's changed also is the technology changed a lot about the way we do these procedures. It's done faster, better. There is less downtime. For example, we are one of the very few in whole New York State dentists who have robot-assisted implant surgery. The precision that you get.
Is that right? It's a robot.
Yes, robots are everywhere now, Randy. So robots assist us in surgery, and you can get precision in a way you just simply couldn't before.
You mean the surgical part of it?
The
Like
surgical
it's a robot arm?
It's a robot arm. Looks just like a Schwarzenegger in Terminator.
Okay,
but, it's not, robot is not doing the surgery. I'm doing the surgery.
Okay.
But the robot helps me place those implants with an absolute precision that we just couldn't achieve before. That means I can plan the way teeth gonna look ahead of time much better. I can discuss with patients the way they want those teeth to look beforehand. I can deliver this surgery with less bleeding, less downtime, sometimes no incision, no cutting. So technology changes, and our expectations of what we can deliver to the patient changes for the better as well.
Now, you're one of the busiest guys in New York doing implant dentistry. Is that right?
Well, that's what I like to do, yes. Busy is good.
And you're all over the internet. I mean, people talk about you. And also, I should tell you, look, we've been doing this program for 24 years. You brought in a stack of photos. We can't even use all of these photos. So you have lots of before and after photos. And I told you, going into this, I always think, well, it's just teeth. But some of these photos that I was flipping through, they are, and I'm not trying to side with you, right? But they're pretty dramatic. It is a big thing. So it is life-changing. Because I always say, well, it's just teeth. But you say it's not.
It's not just teeth. Because who misses a back tooth? your average patient may not even notice.
Okay.
Right? But what it does, it changes the way my patients are able to enjoy their life. When you can go out and eat things that you couldn't eat for years, for decades sometimes. When you can smile in a way you couldn't. When you no longer judged just because of the way you look. Because people don't assume things about you, that you're less successful, less intelligent, less healthy, less happy, right? That's what it's all about. It's really not about putting an implant in someone's mouth. It's about changing their life for better and people able to enjoy their life and not think about their teeth.
Are you ever surprised at what an impact this has on people? That means you give them their upper and lower teeth, a new set. Are you ever surprised?
All the time. All the time.
To them, it was like the biggest thing ever.
That's the biggest reward in what we do. When we have patients tear up once we deliver the final, and they go, "Oh my God, I wanted this for I don't even remember how long. I've never liked my teeth. I haven't liked my teeth since I was a teenager."
Really?
Yes.
Now, because you've been on TV for quite some time, you say some people have watched it for 3 years, put it off and put it off and put it off and finally come in.
I'm so proud of those patients.
And they're still
Randy.
skeptical, though, when they get there, right? Is that true?
Of course, because they've been through the ringer, right? They've been through dentist after dentist telling them, they've done what they've been told to do. They've done root canals, they've done gum treatment, they've done veneers, they've done all of this stuff, and they're still not happy with the way they look. They still can't function the way they think they should be functioning. Just because we're getting older doesn't mean we have to feel old, doesn't mean we have to look old. We're still in our minds 20s and 30s, and we want to live our life that way. So
Good. Do you save teeth sometimes? Like people come in, they've seen you on TV and they think all their teeth have to be removed and they don't?
Absolutely.
So that happens.
Of course, it happens all the time. Yes, there are cases when sometimes all the teeth have to go, or all the teeth have been removed already, so we need to give a replacement. But there are many cases that are combo cases where we can save some teeth, and if those are healthy teeth, we'll do everything we can. We'll pull every tool out of our toolbox and we'll save them.
Nice.
And we'll replace what you've lost. And you'll still get a great result. You'll still be able to smile and chew and do all the things that you want.
So they can eat whatever they want with their new teeth?
They can eat whatever they want.
What do they like more, what they could eat or how it looks?
Great question, but both.
Okay.
Because we get different kinds of patients. And for some, function is the most important.
The eating part.
The eating part. What can I eat? When can I eat my steak? When can I eat the peanut brittle? When can I eat a cucumber?
Okay.
That is what drives them. Now, we give them the function, but the transformation that they see in their face, in their smile, it's always a welcome benefit. Then you see them taking selfies, then you see them smiling with their families on the photo when they never did before. Some of them, the biggest compliment we get is, you know, my friends, they all say something changed about you. We don't know what it is, but you just look healthier, you just look happier. What did you do? Is it your eyes? Did you do plastic surgery? No, they did their teeth, and now they look happy, they look healthy.
So, but what if you have bad gums? Can you do it? I mean, if you have gum disease, can you do this?
Yes, and we do it all the time. One of the reasons people end up not doing dentistry sooner is because they've been trying and trying and trying to fix those unhealthy teeth and unhealthy gums.
So you get rid of the infection?
Yes, and that's the big benefit of doing the treatment. That's why the core value is everybody wants to look better. Everybody wants to chew better. One thing that is not talked enough is about how much healthier does this make you? How much more vigorous you are.
Really?
How much more, physically stronger you are. We have an epidemic of this country of heart disease, of diabetes. Well, this is the entry point to your body.
So if you have an infection in your mouth, there's going to be an immune response.
Of course.
Is that right?
There's going to be an immune response. Your diabetes is going to be worse. Your heart disease is going to be worse.
So the infection goes away, and it's just one less thing for the immune system.
That is probably the most important thing that we can give our patients, health.
Okay. Now, you were saying because I was telling you in the green room that these teeth look really good. So you have like an in-house lab. You have a lab, like a smile designer that meets some of these patients.
Yes.
That helps design the teeth. Is that right?
We design their teeth before we actually do the surgery. There is a process. There are a number of people involved. We always sit down with the patient and we ask them, what do you want to see? We pick the size, we pick the color. Now with the advance of digital technology, we can play around. We can envision what it's going to look like beforehand. And yes, we have a dental technician who is there during the surgery. And we're 90-something% of cases able to give them fixed teeth on the day of the surgery.
That's nice. That's teeth that don't come in and out.
That's teeth that don't come in and out.
Okay. You say a lot of these people go years without smiling.
They go years without smiling. This is the hardest step to do. That first phone call to Dr. George is for a lot of these patients, it's the hardest step to make because they've been suffering for years, sometimes decades. Sometimes they've been told that there is nothing can be done. So they're fearful, they're apprehensive, sometimes they've lost trust. Well, once they come in and they have the options given to them, so they are in control. They are the ones that are telling us, I want this. They have all pros and cons laid out to them. They are making informed decision. They know what to expect. They know how long it's going to take. They know how much it's going to cost. A lot of the fear and a lot of apprehension is removed that way. So they're able to make the decision and make that step that they've been waiting for years, decades to make. Some patients tell me that they've been watching the show. They saw the show 3, 4, 5 years ago. They just couldn't get themselves to make that phone call. Well,
that's the hardest part.
It is the hardest part.
Nobody likes going to the dentist, right?
Well, it's complete opposite of going to the dentist. You go to a regular dentist, you have a lady or a guy in a white coat standing over you and telling you, bad boy, bad girl, you've not been taking care of your teeth. Now you need this, you need that, you need that. No, that's it's different in our office. We ask you, what do you want? There is no judgment.
Good.
What do you want to see? What results do you expect? How long do you want this to last? Let's sit down, let's design it together. Let's walk through the process. And then the reward in the end is you look better, you feel better, you're healthier, you're smiling, and we are happy that we're able to make this difference in your life.
Now we have to mention, and we're very short on time, but dental insurance really doesn't cover this. Medicaid, Medicare doesn't cover this.
Yes, but people are financing this, Randy. We're able to spread out their payments over 5, 6, sometimes 10 years. Okay. So they're able to fit it within their monthly budget.
So they have to have some credit. Is that correct?
Yeah, as long as you have decent credit, you're able to finance it.
Would you say more than half of the people are financing this?
I would say so, yes.
Okay, good, good. Now we're out of time. Final message, somebody watching this, they're the two groups. They either are wearing a denture, they're skeptical, or they have really, really bad teeth and gums. Maybe they've heard what you have to say today, but for whatever reason, they're still skeptical or afraid. What do you say to them?
We know what you're going through. This is what we do every day.
Okay.
We want to change your life. We want to give you smile. We want to give you ability to eat. We want to give you your health back, your vigor back. The most important thing is picking up that phone call and giving us a call.
So just come in and at least know your options.
Yeah, no pressure.
Do they meet you on most of these consults?
Yes, they do. Most of the consults, all of the consults, they either meet me or my wife. We talk about what we can do for them. We give them a lot of education, so that way they can make an informed decision.
All right. Dr. George, thank you for coming on the show. Always a pleasure.
Thank you very much.
If they want to make an appointment, do they go to the website or just call your practice?
Either or.
Either one.
They can go to the website, they can pick up the phone and call and ask for a consultation with me.
Are all these photos on your website they can look at?
Most of them are. You know, we do so many of this that we don't get to update them every day. But yes, they can scroll through the gallery and see who looks most like them.
Dr. George, thank you again for coming on the show.
Thank you very much, Randy.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.